Okay.
Amen.
Well, the pandemic, as you know, is of COVID is something that was declared in March 11 to 20 by the World Health Organization. And worldwide, the figures from a couple of days ago show that there have been 2.9 million deaths worldwide, quite a significant number of people, and infections totaling 139 million cases. Here in Malaysia, we find that there have been 366,000 cases and 1,353 deaths. If you have your calculator, you can work it out to a case fatality rate of something like 0.37, all because of this beautiful golf ball that we see here. This is an electron micrograph of the COVID agent. But I'm running ahead of myself. I think maybe we should just set out what we hope to accomplish today. I will speak for about 20 to 30 minutes, and then we'll have question and answers. Most people think that you should reverse the time allotment. Maybe you speak for a shorter period of time and have more time for question and answers. That probably would be true. We'll see how it goes, okay? And I hope to cover some general aspects of COVID-19, some tests for COVID-19 so that you understand when you go for a check, what you're doing and what they mean. And also, perhaps what's most important is what can we do to prevent getting COVID-19? I'll talk about the common things that you all know about, maybe in one sentence, and then about the hot topic of vaccination, and some tips on staying healthy. Okay? Well, some definitions first. The disease that we are talking about here is formally called COVID-19, okay? We sometimes say COVID for short, but the formal name given by the World Health Organization is COVID-19. And the agent responsible, the virus, as you all know, is called the SARS-CoV-2 virus. Note the way it's written. It's very specific, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. If there is a 2, there must have been a 1 or at least an early infection. And this occurred in the year 2003 when we had the SARS outbreak, if you would remember. And that was when they identified the virus, which is from the family of coronaviruses. If you remember our picture earlier, it does look like a crown, right? All these beautiful decorations on it. Those are part of the proteins on the virus, which we will get into a little bit later. Okay. Coronaviruses actually are very common. You know, your common cold is also a coronavirus. And so it's a very common virus. The difference between the common cold virus and SARS-CoV-2, as you know, is the severity of the respiratory infection and also the compromise in respiratory function that can occur. Okay, about coronaviruses, in 2012, we also had the Middle Eastern respiratory syndrome coronavirus. Okay, what are the signs and symptoms of COVID-19? How do you know you may have COVID-19 or it's just some other common cold? You know, they're both coronaviruses. Very simple. If you have symptoms like a flu, the runny nose and, sore throat, coughing and all that, you have the flu. You have the, flu, quote unquote. You have the common cold, coryza, okay? The symptom that you get with this coronavirus, the SARS-CoV-2, basically You see here in the first three categories, which are common, the others are not so common. Fever is very common, and your cough is a dry cough, okay? You don't have a runny nose and things like that, and lethargy. These are three very common symptoms that may point to having Corona-19 infection. Of course, most people actually have very mild to moderate illness, and they don't need hospitalization. Sometimes they don't even know that they have the infection. Of course, there are some patients are asymptomatic, which means that they don't have any symptoms at all. Now, the incubation period for this disease is 5 to 6 days, 5 to 6 days. So if you've been exposed to someone who later you know had the coronavirus, don't go and get tested the next day. You'll most likely be negative. If you want to know whether you caught the infection from him or her, wait 5 days and then be tested, okay? That's the incubation period of the disease. So recently I had a patient who had, positive for coronavirus, and we all tested about 5 days later, and all of us were negative, fortunately, okay? So remember that the incubation period is about 5 to 6 days. So there is a difference here, and this difference is very important. Having the infection and having the disease are two separate things. In other words, you may test positive but have absolutely no symptoms or some mild to moderate symptoms, which doesn't require hospitalized treatment. Okay, so that is the infection. Of course, if you have symptoms, then we call it you have the disease, whether it's mild, moderate, or severe, right? So infection by the virus and having the disease, COVID-19, are two different things. So bear that in mind. So it doesn't mean that everybody who tests positive, has the disease. He has the virus. He has been infected by the virus, but he doesn't become ill. He doesn't have the disease. So hope you bear this in mind and be able to distinguish between the infection and the disease, okay? As I said, if you have the disease, you have fever, dry cough, tiredness. These are the most common things. The other less common symptoms are, aches and pains all over your body, some loose stool, some diarrhea, sore throat, red eye, conjunctivitis, headache, and quite peculiar to this disease, a loss of smell. So one day you can't smell your food or can't taste your food. Be aware. It could be in this setting when it's very common in the community that you may have COVID-19. Yeah? There's some skin rash and discoloration of the fingers. Okay. The more severe symptoms of the disease is when you have difficulty in breathing. Okay. The infection, once it goes down to your lung, may cause the severe form of the disease where an organizing pneumonia occurs. This is different from a real pneumonia for those of you who are medically trained. Now, when you get infected, the virus resides in your nasopharynx. That is the back of your nose and your throat. That's called the nasopharynx. And that's why when you go for a COVID test, they will swab your nose and your throat. These are the two areas where the virus will first colonize. Once it takes hold, if you don't defeat it, then it may spread down to your lungs. And once you have a shortness of breath and difficulty, you must be admitted to hospital. And for those who go to the ICU, if you get to the stage where you need to go to the ICU and get on a ventilator, a breathing machine, the fatality rate is high. So I think we need to learn to do what is necessary to keep away from having to go to the hospital, number one. Number two, to having to go to the ICU, okay? Or if you have pain in your chest, I feel like it's so heavy that you can't breathe again, and you're so out of breath that you cannot speak. These are signs that you need to call in Malaysia 999. I think there's only one emergency number. And be admitted to hospital, or if you've been detected earlier, they'll probably transfer you from what do you call the centers that they have, quarantine centers to the hospital, okay, to the hospital. Okay, how does the disease spread? How does the disease spread? The disease spreads mostly by droplets, okay? It's a droplet spread. However, aerosol or respiratory spread, that means it can spread just by being in the air. That has been described and is known to occur, but it is quite rare. It is quite rare. The most common and predominant way in which the virus spreads is by a droplet. It's a droplet infection. By a droplet, you mean that the particles that come out from your mouth, your nose, when you sneeze or whatever, is more than 5 microns in diameter. And they don't usually travel more than a meter. Okay, does that ring a bell? How far away should you be from someone else when you're in a public space?
1 meter at least.
Yeah, 1 meter, right? So this is not just an arbitrary figure that somebody thought about, you see, because we know the spread of the disease. It spreads by a droplet infection. And would a mask be helpful? You see this debate going on, some anti-maskers and so on and so forth. Would a mask be helpful? Obviously, right? A mask is helpful and it prevents a person from spreading it. It does prevent a person from getting it to some extent. I'll agree that masks maybe are not so useful for, preventing you from getting it, but from spreading it, definitely. Yeah, definitely. It's a droplet spread, and usually droplets get into the atmosphere, they'll drop down to the ground in about the space of 1 meter. On the other hand, if your saliva or your secretions are aerosolized, become very fine particles in the air that are less than 1 micron, which means they can really float in the air, okay? And they can be, spread by your air conditioning in the room and so on and so forth. Therefore, you'll find this figure again being given that if you spend time with a person more than 15 minutes, then your risk of contracting the disease is high, especially in a confined space, in a meeting room and so on and so forth. Huh? And this is because aerosol spread is known to occur, but to what extent is not very clear. But we know it can occur. The dominant spread, however, is by droplets. And so make sure you keep a meter away from anybody in the public space, okay? So what are the tests now? We go to find out if you have COVID-19, all right? So infection or COVID-19, all right? Remember, infection just means that the virus has invaded your body. You've had a brush with the virus. COVID-19 means when you have the disease, when you become ill. Okay, the gold standard test is what is commonly called the PCR. Okay, you don't have to remember all the long names jargon that we use in the hospital, medical professionals. It's a RT-PCR. It's usually a real time. There's another Q, RT, small q PCR, okay? It's a reverse transcriptase polymerase chain reaction. Okay, PCR for short. That is accurate more than 98% of the time. Very accurate, very accurate. It's so accurate that, as I mentioned earlier, even if you are recovering from the disease and you have just a small amount of particles of the virus, it will test positive. So it's a test not used to really rule in the disease, but to rule out. If you're PCR negative, you can be quite sure that you don't have the disease. Another test that is less accurate, that's often done, is cheaper, it's faster, is the antigen test and antibody tests. rarely do we do antibody tests. We're not too sure the value of it or what it really means. Just may mean you've been exposed to COVID-19. Now, if you have been immunized, you should have some antibodies. So the antigen tests done commonly because it's easier to do and it's cheaper and faster. Okay, there are rapid tests also that you can do that are based on the PCR principle. There's a BioFire from Germany. They do a FilmArray test. It's very sensitive again. Sometimes it can be, if you're too sensitive, there's always a problem, right? And I'll tell you what some of the problems are, because you'll be picking up people who are, don't have any significant infection at all. They're infected, no doubt, but they don't have the disease and they don't come down with the disease. One thing about the PCR test that is done, it's a nucleic acid amplification test. In other words, there are many cycles they go through, they call CT, and your test will have a CT number. In other words, they double the amount of particles in the test, so that if it becomes positive early, then we assume that there's a high viral load. If it becomes late, then it may not be important. The number to remember here is about 25 to 30. If your PCR test becomes positive more than 30, you're almost sure that you're not infectious. If it is less than 30, the lower the CT number, and that's the cycle transition number, when it transitions to a positive test, then it means that the viral load is higher. Okay, so this is the coronavirus, as we saw earlier. You must have heard terms like the S protein, the red blobs that are sticking out are the spikes, and they are the ones that will show the S protein being positive, okay? So when you do a PCR test, for instance, they will test for the S protein. They will test also for the envelope, the E protein. The yellow ones, those are the material from the envelope. And the orange ones, those are the membrane protein. The virus has a fat layer, a lipid layer that envelopes it. And this is important when we talk about hand hygiene and washing and so on and so forth. Because it's a lipid virus with a lipid membrane, you need to use things that will disrupt fat, like soap and alcohol, okay? Now, what can you do really to prevent getting COVID? As you know, an ounce of prevention is worth a cure. The treatment of COVID, there are some general measures and medicines that you can take, not very standardized. The use of steroids in the severe cases has been proved has been life-changing in ICU if you have a serious illness. But we're hoping, not to get to that stage. Anyway, when you get to that stage, the treatment all is out of your hands. It goes into the doctors who are treating you, right? So as we talked just now, masking is important. Don't believe people who say that masks don't help and so on and so forth. It's not true. Masking works, and it's one thing that we all should practice. Then social distancing, and you know the reason why, keep at least a meter away. So if anything, the person next to you spews out, and because COVID is a droplet infection, it'll fall to the ground in about a meter space. So if you're further than a meter, you'll be spared, okay? Of course, if you can restrict unnecessary travel, and that's the reason you see all the clampdowns that we have. And hand washing. Okay, this comes to a very practical, important topic that we can do to prevent getting COVID. Wash your hands as frequently as you have an opportunity to. And for how long? As I told you, the envelope of the virus is made out of fat, and it'll take some time for the fat or the detergent to disrupt the virus and kill it. So they say you should wash your hands, you should soap it for about 20 seconds. And, sing happy birthday twice. That will give you 20 seconds. Of course, you don't have to sing it loud. Unless you have a voice like Rose, then, perhaps it may be appreciated. But, for many people, it may not be. It says my connection is unstable. Are you able to hear me?
Yes. Loud and clear.
You okay there, Pastor?
Loud and clear.
Loud and clear. All right, good. Hand washing is preferable to sanitizers, okay? But you don't find this thing everywhere. You can carry some soap, simple soap and water. You don't have to have anything fancy, okay? Simple soap and water. Or if you don't have soap, even water, will help. Alcohol will definitely dissolve the fat, and hand sanitizers work. But after a while, it kind of builds up, right? It kind of builds up. So even though it's convenient to have a hand sanitizer in your pocket, which I carry all the time, thanks to my friend Danny Tan, who gave me a whole load of hand sanitizers with the orange flavor, the orange smelling essential oil. Wonderful. Okay, hand sanitizers. And the other thing that has been suggested is to cocoon the elderly. In other words, don't go to visit your grandparents. Maybe it's a good excuse for you now. And make sure that they are not exposed to someone who may carry the virus. All right. These are some simple general measures that can be adopted. For one thing, COVID is real. All right. Don't believe the conspiracy theorists who even today will tell you that, it's something imagined. COVID is real. We know of close friends who have died from COVID. One of them in the UK, who worked in the ICU, okay? A healthcare worker who was exposed to COVID. And COVID is real. And these are some simple measures that you can practice that will help prevent getting COVID, okay? Now, who is likely to get COVID and who's unlikely to get COVID? Young children apparently seem to be quite immune to COVID. We know they do get it, but at a much, much lower rate than older people. Up to the age of 12 years old, COVID is rare. But for adults, those with high blood pressure, obesity, particularly obesity is a condition that predisposes a lot of people COVID. If you have diabetes mellitus, chronic kidney disease, or if you're taking an immunosuppressive drug for an autoimmune disease, if you have heart disease, or any, immunocompromised condition, even if you have cancer of a chronic illness. Okay, what specific things can you do? I beg your pardon, excuse me. Prevent COVID that you can take, some medicines that you can take to prevent COVID. These are some simple things you can buy from the pharmacy off the counter. What's important for you here is to note the dosage, okay? The dosage. Vitamin D3. Vitamin D3 is not only important to boost our immune system, but it actually is involved in a whole load of other body reactions. and it's related to chronic ill health, even to cancers, diabetes, and a lot of other diseases. This knowledge about vitamin D has only been in recent times that people have realized that they can improve their health in general and the immune system in particular by taking vitamin D3. Okay, the amount you need to take is between 1 to 3,000 international units per day. Some tablets you buy in the pharmacy will have only like 400 international units or 800, and they will quote that the normal amount of vitamin D a day that you need, a daily requirement is only something like 400 units. But that's not enough really to boost your immune system. You need between 1,000 to 3,000 units of vitamin D, okay? Write it down. After the talk, go to the pharmacy and get yourself a supply, and it will be of help to you, okay? The next is vitamin D, vitamin C. Here again, you need at least 1,000 to 3,000 units a day. Taking 1,000 units twice a day is good. Vitamin C, as you know, is also related to a lot of other health issues, your common cold and so on and so forth, but the dosage has to be correct. Paul Innes found the Nobel Prize winner, up to 10 grams of vitamin C, 1,000 units a gram, right, for the common cold. So if you want to take vitamin C to avoid a common cold, the dosage has to be high. You will know if you take too much. Actually, it's very hard to overdose on it. If you get diarrhea, then you know you've taken too much vitamin C. But you can take up to 10 grams a day. And if you're coming from a cold, that may help avoid a cold. But for general use every day to help, immune system and to keep COVID at bay, taking 1,000 to 3,000 units of vitamin C per day is helpful. And I must come up with my proviso here, and all doctors, when they appear on TV or YouTube, must tell you that, I'm giving you general information, but, in each particular situation, make sure that you consult your health physician, which I'm telling you now, okay? Don't say I didn't tell you, to see what is best for you, all right? These are some general recommendations that we're coming up with. So if you think I'm going to tell you whether to take a vaccine or not, you may be a little bit disappointed, but we'll discuss vaccines as we go along, all right? Quercetin, 250 milligrams per day will help you. Quercetin are flavonoids. These are the polyphenols that you find in a lot of plants and vegetables that are antioxidants, they're anti-cancer, and they are anti-inflammatory agents. Okay, again, you can get this from Lazada or any kind of pharmacy. I'm not too sure about the pharmacy, right? So the fourth one that we come to is zinc, all right? Zinc is crucial to health and your immune system. Here again, the dosage is key. Most tablets that you find and you buy from the pharmacy will have 15 milligrams of zinc. You need more than that. You need between 30 to 50. And make sure it's elemental zinc, not a zinc compound, not a zinc compound. Then melatonin is a natural hormone that you can take at bedtime. I need to run along, Pastor Ho. Otherwise, I won't get invited back here again. I'll finish in another 10 minutes.
Take your time. Take your time.
Believe me, okay? As far as treatment, there are a lot of clinical trials showing that ivermectin is a very effective drug to use. Ivermectin is an anti-parasitic drug. But unfortunately, the World Health Organization, the FDA, and the CDC have advised against the use of ivermectin. The NIH has come out now and changed their stance from advice against to neutral. There are over 80 clinical randomized trials that show the effectiveness of ivermectin. But I think it's because the push on vaccination is going on that, they're putting roadblocks in the use of ivermectin for general purpose. But there are many countries in the world who are using ivermectin. And of course, vaccination. Should you vax or not? Okay, I'm not an anti-vaxxer, all right? I have taken hepatitis vaccines, and I've taken a lot of other vaccinations. And okay, here's some of the common vaccines that we hear talked about. Shall we see the other one? Okay, we come to the Pfizer vaccine and the Mrna vaccine. They're basically very similar. One is, I'm not too sure where they're produced in. Okay, anyway, they are RNA vaccines. Okay, there are a lot of misunderstanding about RNA vaccines. Are they safe? Are they effective? As far as vaccines are concerned, you'd have seen the health department come out very strongly and telling people that even if you're vaccinated, it doesn't mean that you won't get the disease. All right? So you may still get the vaccine. Whether you can spread the disease, they're not very sure about that. But vaccination does not prevent you from getting COVID-19. What all the evidence now shows as far as the vaccines is concerned is that if you do get COVID-19 after being vaccinated, you are very, very unlikely to get the severe form of the disease. Okay, that is the plus point about the vaccines, all right? These are messenger RNA vaccines, the Pfizer vaccine and the Mrna vaccine. They all have the typical vaccine side effects that you get after a jab, with a redness, with a fever, being unwell, and so on and so forth, all right? A bad reaction is very rare. And death after the vaccine also is very rare. I don't think, that is something that should dissuade you from having a vaccine. All right. Now, recently in the news, you must have heard about the Johnson & Johnson vaccine and the Oxford AstraZeneca vaccine, which have been put on hold, have been paused for the moment because of thrombosis that occurred. These are a different type of vaccine. They use a virus, adenovirus, as a carrier for the vaccine. And somehow, in its response in the body, antibodies to platelet factor 4, this is some jargon for many of you, don't worry about it, that can induce clotting in the body. It's quite complex. It induces clotting by consuming the platelets, and then when you don't have platelets, you can bleed. So, it's a very tricky situation. But the sinuses in your brain, the venous sinuses, the blood, venous blood in your brain can clot. And there have been a few cases now that have occurred, all right? So, yeah. AstraZeneca, I don't think has been rolled out in Malaysia yet. But the next one that's being rolled out, I think, is the one that you have on the left here. That's the Sino-Vac Vaccine. A lot of people say it's a very safe vaccine, but that may not be so true. The safest vaccine actually is the mRNA vaccine. The mRNA vaccine is safe in the sense that you cannot catch COVID from it because it's not the virus. It's just, a small fragment of the virus. And whereas the Sino-Vac vaccine and the Bharat Biotech vaccine, these are live attenuated vaccines. In other words, they take the real SARS-CoV-2 and chemically inactivate them, all right? Hopefully to the extent where they will elicit a response from your body will produce antibodies, but you won't get ill. However, if you have a very weak immune system, okay, you may get infected from the vaccine. That's possible. Just like the polio vaccine. In a very small percentage of people, they'll actually get polio when they take the vaccine, in the life attenuated form of the vaccine. So contrary to what people are telling you now, that the Sino-Vac vaccine is probably the safest of all the vaccines because it's old technology, I think the evidence now doesn't support that. It's all technology, right? It's the way vaccines have always been made. You inactivate the offending agent and inject it into your body. Okay, so the question of whether you should have a vaccine or not, I'm not going to recommend one way or the other for you today. But to save you asking me the question, I've opted not to take the vaccine because I believe that there are other ways in which to stay healthy. And you saw, even if you get COVID, okay, barring age and so on and so forth, all the figures we saw, there's only 0.37% of people in Malaysia who got the vaccine died. It's less than 1%. Very, 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 very small. So is it worth taking the vaccine, the mRNA vaccine, for instance, that doesn't have long history? And what are the long-term effects that can come out from the vaccine? Nobody knows. That's a big unknown. All right. But if you're asking me in the short term, is the vaccine safe? Yes. In the short term, I think the vaccine is quite safe. Is it effective? It's effective for preventing you from getting severe COVID-19, but it doesn't prevent you from getting COVID. You may still get COVID, okay? Then you say, what's the use of a vaccine then, Well, there you have it. So this is really a judgment that you need to make for yourself, depending on your situation, whether or not to be vaccinated. If you feel that your risk of getting COVID is high and to get severe COVID, then probably vaccination would be a sensible thing to do. But for me, I've opted not to do the vaccination. Okay. Now, quickly round up, what are the other things that you can stay healthy? When you talk about immunity, there are two kinds of immunities. The innate immunity that's built into you, that is less discriminating. It will fight against any kind of bug that gets into your body. And there's more acquired immunity. When you get an infection, your body mounts an antibody response to a particular infection to take care of it, okay? Ways that you can improve your innate immunity are basically, ways of healthy living. There's no shortcut to, being healthy. We know most of the general principles here. And I thought this was interesting from the Mayo Clinic. There are 7 tips of healthy living. Eat nourishing food. Sleep 7 to 8 hours per night. And about sleep, you need to sleep between 10 p.m. to 1 a.m. At least during this period of time, it's important for you to be asleep because it is the time when the growth hormone is secreted to repair all the damage in your body, okay? So if you want to have all your worn-out cells repaired during the night when you sleep, this is the time to be asleep. 10, 11 at the worst to 1 o'clock, all right? And you need to have about 7 to 8 hours of sleep a day. Keep company with good people here like Utama Beacon Church, Avoid the news, it's all bad news these days. Regular exercise, okay? The in thing now is to have a high intensity intensive training, HIIT. Yeah? You can look it up, talk about it some other time. And do something meaningful each day. Get up, go to work. I still work because I'm afraid of retirement, man. I see people go downhill when they retire. I know, I still can work and do everything that's required of me. So I still go to work. And think good things about others, it comes back to you, all right? It reminds me of the Christian imperative. In 1 Corinthians, Paul says, do you not think, I beg your pardon, Do you not know that your body is the temple of the Holy Spirit who is in you, whom you have from God, and you are not your own? For you are bought with a price, therefore glorify God in your body and in your spirit, which are God's. So the father of modern medicine, Hippocrates, is famously to have said that, make food your medicine and medicine your food. So what are the nourishing foods that you need to eat? Dark green vegetables, okay? These are the superfoods. Broccoli, kale, collards, and yeah. Color is important. Nature has made color to attract us, okay? So dark green leafy vegetables, fruits with color, deep color, okay? And same thing here with fruits that you need to have various colors, Try and match up all the colors when you eat. Avocado is regarded as a superfood. Eat one a day, if you like it. And papaya, durian may be the king of foods in terms of taste, but in terms of nutrition and the value to your body, papaya is the king of fruits. Papaya. Pineapples have something that fights against the COVID virus. Okay, so at this time, and there's a SARS-CoV-2 epidemic, is COVID epidemic, eating a lot of pineapples would be a good idea, right? Basically, you're talking about plant-based foods, and Dan Buettner, in his book, The Blue Zones, talks about where people live, to be 100 years around the world. And the places, have basically a plant-based diet, the Mediterranean diet, in Sardinia, in Okinawa, Loma Linda, California, and other places. So if you want to know what you need to take to live to be 100 years, maybe you ask Utama Beacon to organize a talk, and I'll be happy to share my ideas about it. Because I plan to live to 100. I don't know about you. So if you want to join me in this venture, perhaps we can do it together. Another thing they found, especially for heart disease and also to stay healthy, is eat a fistful of fruits a day, a handful of nuts. Okay, if you're a big guy, your hand will be bigger, so you need to eat more nuts. And, eating nuts definitely promotes cardiovascular health, and also brain health. So of the various nuts, these three here in the lower section, macadamia, pecans, and walnuts. You recognize your nuts? Do you know your nuts? Are ones that you should go for. Okay. So, beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. This is my prayer and wish for you today.
Amen.
Sorry I took so long.
No problem, not at all.
Thank you, Dr. Poey, for the we are loaded with information now. Some of us have to write down, some of us have to quickly screenshot. Okay, this time I would like to pass on to Alex to help us. Everyone, please feel free to on your videos, because we're going to take a quick photograph. Okay, make sure your video is on, and then we will proceed with question and answer after taking photos. So make sure you smile. Alex, over to you.
Okay, first thing first, video on. All the videos on. If you want to put on your makeup, better be quick. Okay, I see here there's 3 sections, so that means I have 3 groups here. So I'm going to take the first one first. Are you ready? And please smile. 1, 2, 3. Okay, next group. Ready? One. For this group got less video on, please, like Lenovo Tab, PS, Christine Teo, I need all of you to on your video. Esther, Furake, Redney, Roslyn, video please. I need to see faces. Ready? One, two, three. Okay, last group. Oh, this group is only nobody video on. Okay. All right, done.
Thank you.
Rose, you are muted.
Thank you. Sorry. I believe everyone is ready for the question and answer session, but let me roll the ball first. I have one question here from Sister Mei Hui in the message box here. What kind of mask should we wear? Dr. Alfred?
What kind of mask should you wear? Try not to wear a cloth mask. Okay, there are a lot of cloth masks that are going around. And they tend to grow fungi and stuff after a while. Unless you discard it every day, you're going to wash it and so on and so forth. In the healthcare setting, we use an N95 mask, but that's not necessary for everyday use. You need to use what's called a 3-ply mask. Okay, that probably will be adequate. In other words, you're talking around about what, $20-30 a box. Yeah, not the ones that are terribly cheap. Medicos is a Malaysian brand that is of good quality. But yeah, a 3-ply mask.
Okay, thank you, Doctor. Next question. I hope it's answer your question, Sister May. Okay, next question here from Miss Christian Tan. Can a person with high blood being vaccinated? I think it's high blood pressure.
Yes. Somebody with hypertension, yes. There's no contraindication. In fact, there may be a stronger reason to be vaccinated because, as you know, you're more likely to get COVID-19 if you have high blood pressure, if you're obese, if you have heart disease, you have diabetes. These are conditions that predispose you to getting COVID-19, the serious form of COVID-19. High blood pressure is not a contraindication for vaccination. But when you go for vaccination, make sure you take your high blood pressure, okay? If your blood pressure is very high, even if you don't go for vaccination, you go to the clinic, if your blood pressure is more than 200, there's something that needs to be done for you. So you're quite likely not to get your vaccination done if your blood pressure is that high. So if you're a hypertensive on regular medicines for it, make sure you take your medicines before you go for the vaccination. But that's not a contraindication, no.
Thank you, Doctor. Oh, there's another question here. For the rest of you, if you feel like you want to unmute and speak, also no problem, yeah. But I will reading from the chat first. You can just unmute if you have a question. All right, next question was, what can you share about the variants that are around now? Are they more severe? Again, from Sister May.
Yeah, there are several variants. You have the South African variant, you have the UK variant. They all got numbers attached to it, if you're not to be so scientific. Some are said to be more virulent, more easily, catch it more easily. There are some variants in the country. Yes, yes. So that's part of the problem with the virus, because especially in a pandemic, some people have expressed their concern that if you start vaccinating people during a pandemic where there are a lot of people with the disease, then your chance of having mutations and variants will increase. And you don't have vaccines for that. You can't be developing vaccines, so rapidly, you see. So that's one reason against a mass vaccination during a pandemic. So you need to find a form of treatment that can be used during the pandemic.
Doctor, can I ask a
Yes.
question?
Sure.
You mentioned all the food, but you never mentioned about the meat. No, what kind of meat which you can consume?
What kind of meat you can consume, Yeah,
No,
red meats, I think,
early.
should be used, eaten very judiciously. The high incidence of cancers of people who eat meat, for instance. Yeah. A plant-based diet definitely outpaces a meat diet. So I think if you really want to have optimal health, eat as little meat of any kind. But like we mean plant-based, we don't mean exclusively plant. I mean, most of your calories, your proteins do come from plant sources. There's a misunderstanding that plant sources cannot give you enough protein, but that's not true. In fact, all primary protein comes from plant. You think about it. Where does the cow get its protein from, man? It gets from the grass, Huh? And you eat the cow. The amino acids all, it may be a complete protein. Meat may be a complete protein, has all the amino acids, but actually all the various building blocks come from plant sources. There's no such thing as a protein source from meat. Those are all secondary. It becomes a secondary source. Yeah. So eating habits and so on and so forth are very difficult things to comment about. But if you want to have optimal health, I think having a diet primarily of plant sources would be best. In fact, some heart doctors, with tongue in cheek, they often tell their patients, or not often, I sometimes tell my patients, and they ask me, what should they eat, I say, if it tastes good, spit it out. Some people, when you tell them to eat broccoli, and kailan and spinach, wow, it's almost like a death sentence to them. But yeah, those are primary food sources that you can consider. Sorry?
The meat all contain the protein, you see, because now you take all plant-based, which kind of plant-based contain most protein?
We got a lot of legumes, for instance. In fact, if you get enough calories from plant sources, you can, get enough of protein sources. Okay. Should I just share my screen? I think I had a picture there. Can I show you? Yeah, here you have pound for pound more protein in these foods than in meat. You believe it? You didn't. But you go look it up, check it out. Pound for pound in garbanzo beans, in lentils, other legumes, you have more protein than meat. Surprise, surprise, yeah, but it's true.
We eat a lot.
How much should you eat?
How much to eat in order to supplement the meat?
Like I was mentioning to you, weight for weight, they give you more protein than meat does. And yeah, what other things contain protein in plant sources? There are lots. Beans, legumes, hemp. You can even get hemp protein. Hemp protein is a very good source.
All the green vegetables have protein as well.
Yep. It's just that, misconception that it's very common in society. That, you eat vegetables, you'll be weak, you have no strength, and you must eat meat. Maybe it makes you taste good, makes you feel good. But if you look at the scientific evidence, no, yeah. You get enough protein from plant sources.
There are some more questions.
Yeah, some more question in actually in our chat box here. Okay, next question is from Sister Grace Chan. It's related about the mask. What about fabric mask with changeable filter?
The whole concept of mask with a filter, or no, not a valve, a filter. Yeah, the same thing. You need to. It depends how often you change it. Just the filter, you're changing the whole mask. You should just use it for a day. That's it. And wash it or something. There are some masks that have impregnated silver, and they say you can use it for a week and so on and so forth. But I don't think that's really advised. But also, even if they're disposable masks, you need to dispose of them at the end of the day. At least not more than one day. In fact, maybe you need 2 in a day. And putting the mask on your arm and touching it and so on and so forth could actually be a hazard to you, because it could be collecting some viruses, albeit in smaller doses. But over time, it's collecting more and more viruses. You shouldn't be touching your mask and doing all things with it, taking it out, put it in your pocket. Yeah. So the proper use of masks is a whole different topic. And some people who are against masks actually say that most people don't wear masks properly anyway. So it doesn't do much good. A fabric mask with a filter, you'll have to show me the mask and see where you put the filter. Or you just only remove the filter and the fabric is still there for a couple of days? Or do you, change the fabric mask every day, wash it every day? And also the pore size may be a bit large. So I think it's best really to wear a disposable mask and dispose of it. Definitely by the end of the day, in some circumstances, maybe more often.
All right, we move on to the next question. There's many questions here, actually, Dr. Alfred. I hope you are.
I'm fine. I can stay here.
Yeah, stand by with your water. Okay, next question from Huawei Nova. There's no name here. Can vitamin D be overdosed if we go with regular sunshine in Malaysia? It's another different topic, but yeah.
Can you overdose with vitamin C? You can overdose with anything. You can overdose with water. You can overdose with salt. You can overdose with anything. But in the normal use of it, within the ranges I told you, you don't overdose. In fact, you may still be under. I'll challenge you to go and have a vitamin D test. You'll be surprised. 80% of you will be under. You'll be deficient in vitamin D. I give you a challenge now. You don't believe me, you go and take a vitamin D3 test. And you'll find it is well known that more than 70% of the population is deficient in vitamin D.
In the world.
Yeah, in the world. And
the
when we say when Malaysia is a hot climate and all, you get exposed to vitamin D. I'm not too sure, man. I see all
Well,
this.
I've
all
been
this.
doing vitamin D for my patients for the last 3 years. Of all those people I've done, I think only one Malaysian has enough. Many of them are deficient, less than 25.
Yeah. This is just if you only take this away from today, you can improve your health tremendously by taking vitamin D. You go look it up if you don't believe. You can check it out.
Doctor, the vitamin D is a chemical base or plant base? Which
Where do they manufacture vitamin D from? I really don't know. I have to find out. I think it's mostly plant-based. Yeah. Cholecalciferol. I know the chemical name. Yeah.
Continue with the questions.
Okay, next question will be, what about the thyroidism medicines? Is it okay to vaccinate?
Yep. No reason not to.
Okay, next question from Sister Angela. Should a healthy person be vaccinated?
It's hard to define what health is. Health is not merely the absence of disease, because you don't have anything wrong with this. We talk about positive health. Huh? So health is really a whole spectrum. When someone is ill, we know very sure that he's ill. But in the whole spectrum of health, are you as healthy as me? Are you as healthy as someone else? How do we measure that? That's very difficult to measure. So when you say healthy, I presume you're talking that you don't have any illness. Yeah. And should you be vaccinated? I think you have to weigh the risk. Like I told you, one of the drives toward vaccination is to get 60 to 70% of the population, what they call herd immune to COVID-19. That will stop the spread. To stop the spread of the disease. Yeah. In the SARS epidemic or small pandemic, they found out that when the population reached about 60% of people, there was enough herd immunity to suppress the spread of the disease. So even if you're well or unwell, the aim here in the country really is to get up to 60% of the people vaccinated. At least 60%.
Yes, so would it be applicable if I were to just sit and wait for the whole world, 60% of the world population get vaccinated and say, hallelujah, thank you very much, and I don't get my vaccine and I'm safe anyway?
Yeah.
Well done.
Then, so, how do you look at that? Would that person be actively contributing to the community, or is he looking out for himself? The different ways of looking at it. So for me personally, I think it's a bit too early to know what the long-term effects of the vaccine is going to be. Like Angela, I said, I'm in good health. I don't take any kind of prescription medicine at all. I haven't been in hospital for 50 years. The last time I was in hospital, and I had mumps and had to be isolated when I was about, around 20 years of age, I think. But other than that, I've never been admitted to hospital. I've hardly ever been ill. Yeah.
Okay, doctor. There's another question here from Galaxy Tabs S2. Would person with drug allergy safe in taking the vaccines?
It depends how severe the allergy is. If you have had an anaphylactic reaction, in other words, if you have had, angioneuritic edema, your voice change, your face, your eyes swell, if you had a severe drug reaction, then you should be very cautious. Yeah. So in other words, minor histories of allergy doesn't, it's not a contraindication to having vaccination, but only if you have had severe reactions to it. You shouldn't take the vaccine if you have a history of severe reactions.
Should be apps.
I didn't catch it. And if you had an anaphylactic type of reaction, yeah.
Okay. Next question from Isaiah. First dose of vaccinations get severe reaction. Is it advisable to continue with second dose of injection?
Severe, I think you need to really define what severe is. If you like nearly passed out, got admitted to the hospital, then I think, you need to be wary. But, oh, yeah, severe reaction, severe pain, fever, maybe. Pain, again, is quite a subjective element. Yeah. Whether you've been admitted to hospital, the severity, I think this depends on the severity of it. In fact, some people think that a single dose of vaccine should give you immunity over time. Having a second dose really is an insurance. There's some vaccines that only do one dose. Like, for example, the Johnson & Johnson vaccine, you do only one dose. Whereas the Pfizer and the Moderna one, you do 2 doses. Most of them are 2 doses. Traditionally, you do vaccines with 2 doses.
Okay. Next question from Yok Teng Lim. Is it safe someone had a thyroid and thalassemia to vaccine with AstraZeneca?
Thalassemia, talking about blood disorder, and you think, if you get clotting and so on and so forth. Yeah, thalassemia, because thalassemia serves, you can get some intravascular clotting. So I think you should be a bit more careful there. Yeah. I don't know if it's an official or recognized contraindication, but certainly I would check a little further. Yeah. I can't give you an answer right out now. I would certainly have to look it up.
Okay, thank you, Doctor. Next from Nuntari Silo. Nowadays, I see advertisement, a banana a day keeps the coronavirus away. How effective is the banana?
That's new to me. Banana is good for lots of things, but I'm not too sure it'll prevent you from getting coronavirus. It may help in your general health. Like I told you, to have a good, robust general health is important to keep the virus away or keep any disease away, to build up your innate immunity, to have a good microbiome. Actually, our body is full of bacteria. You may be surprised that millions of bacteria, billions of bacteria in our body. And most of them are good bacteria who help maintain your health, especially gut health. They say 80% of your health problem is related to your gut health. So you find a lot of probiotics that are being promoted. And I think with good justification. So, I think a banana helps like many other kind of fruits for your general health. I'm not too sure that it being specifically useful for COVID.
There's another question from Yongtek Lim. Beans, is lectin a problem to our digestive system?
Yeah, the whole question about lectins, huh? Yeah. Don't have a short answer for that. Maybe one day we can talk about it.
Yeah. Okay, next question from Teo Bak Ju. I'm going for my vaccination test on this coming Monday, but I'm still on my antibiotic medication, Zainat. So is it safe to do so?
It depends what you're taking the antibiotic medicine for, but it should be safe. There's no reason why you shouldn't keep your appointment, considering the fact that it's difficult to get an appointment for vaccination. Here we are trying to get your body to produce antibodies against the SARS-CoV-2 virus. You're taking an antibiotic which probably is trying to treat a bacterial infection. So they're quite unrelated. I see no reason why, you shouldn't go for your vaccination. I think you should go.
Thank you, Doctor. Next question. I believe I still have two or more to come, Doctor. All right. From Brother Jeffrey, what's about NSAID patient? Is it safe to get the vaccine?
What patient?
NSAID.
NSAIDs are kind of a medicine. Generally you shouldn't take NSAIDs with vaccine. If you have pain, fever, you can take simple aspirin or paracetamol. Yeah. Don't take NSAIDs. NSAIDs are contraindicated to be taken after vaccination. Yeah.
Okay. Next question from Heng Amoy. I'm on alphabet. Sorry if I pronounce it doesn't sound like this one. Epixben, a blood thinner, as I had DVT. Can I take the vaccine, and which vaccines?
Yep, you can take a vaccine. The mRNA vaccines, I think, are the safest. Even if you take the AstraZeneca, you've already almost got the treatment for the thrombosis. Yeah, but I wouldn't think those would be the ones of first choice for you. I think an mRNA vaccine, if you wouldn't have a vaccine at all, yes.
Okay, I think we will take around 3 to 2 questions. After this, we will have to end the session. Okay, next question from Isaiah. Some vaccines seems to have efficacy rate as low as 50%. Why do they promote?
Something is better than nothing. In fact, you'd be surprised that to qualify as an effective vaccine, they're only 50% effective. Yeah. Well, those are kind of accepted terms in vaccine development. Yeah, 50% is the lower level of acceptance. Yeah. It raises some question, why take a vaccine? No? But if you can prevent 50%, 100 people can prevent 50. Not too bad, is it?
Yeah. Okay. I didn't see any coming message now. So I believe that around 60 to 70% you have covered, Dr. Alfred Poey.
Oh.
It's good, it's good. All right. So yes, we heard about the sharing from Dr. Alfred Poey. And yes, most of them is very relevant question. There's one thing that actually I feel children has to know, and it's really tell me that I have to tell the children in our Utama Beacon Church actually that how to wash your hand in 20 seconds, then you sing happy birthday song. This is a very good info. Okay, thank you for the tips, Dr. Poey. Yeah, and also thank you all for your question and also your feedback as well. Sister Valerie.
Thanks everyone. I may, not only consider it a privilege to have been able to share with you, but also maybe a pleasure. Yeah. Thank you all.